If you work in healthcare, you know how complex the prior authorization process can be. It's time-consuming and often inconvenient for both you and your patients. Virtusa has a solution to ease this process. Virtusa's prior authorization solution streamlines the process, making it more efficient and less burdensome for everyone involved. Our solution has 6 interconnected modules such as intake, admin review, clinical review, peer-to-peer review, correspondence, and external entity review. Now, let's take a deep dive and see how these modules benefit different users. The enhanced UI incorporates intuitive features that simplify and streamline the process for the intake user when creating an authorization request. The application also caters to the need of different authorization types such as admission request, outpatient, durable medical equipment, and pharmacy. When a member seeks outpatient services, they can initiate an outpatient authorization request. Integrating member and provider databases simplifies the verification process and dedicated feature for out-of-network providers. The solution can accurately identify and process the latest ICD-11 codes for diagnosis information, as well as CPT and HCPCS codes for procedure information. Additionally, users can add multiple diagnosis and procedure codes based on the treatment process. The application also includes a duplicate checker to enhance operational efficiency, which prevents the creation of similar cases. The reviewer in the admin review module verifies whether or not the user has submitted the correct clinical documents. The solution provides a document checklist and an upload feature to ensure this. These documents will be necessary for clinical review, and the case will not proceed without them. The registered nurse performs the clinical review by examining all the case facts and documents provided by the member, and necessary clinical guidelines for the same have been integrated. It will be easier for the nurse to access diagnosis and procedure information along with all necessary reports and documents. The skip mechanism is available to save time and expedite the case resolution. Once the nurse completes the review, the medical review coordinator or MRC and medical director or MD will review the solution to verify the documentation and decisions made by the clinical nurse and complete the documentation process. If a case is approved, the solution will automatically send an approval correspondence to the concerned party, and the case will proceed to resolution. However, if the case is denied, the MRC will complete appropriate documentation and a denial correspondence will be sent automatically. If the member disagrees with the denial, the MRC will initiate a module called peer-to-peer review, where they will arrange a meeting between the medical director and the care provider based on their availability. The solution has the feature to cater to the calendar availability of both parties and will assist the MRC in selecting an appropriate time slot. Users can make notes of the arguments presented by the provider and MD in the solution. If the decision is changed, the final MD review module will provide the MD with the meeting minutes to assist them in making the final decision. Finally, the solution will send correspondence to the concerned parties. Now let us see how Virtusa's prior authorization solution assists in the admission scenario. For pre-planned admission scenarios, like when the date of admission is in the future, the intake user may use the pre-cert authorization type. In such a scenario where the diagnosis and procedure information is approved before the admission, providers may choose to perform additional procedures based on treatment outcomes, which may require additional days of stay. Our prior authorization application is equipped to handle these scenarios through a comprehensive admission review module covering the entire patient journey, from pre-certification to discharge. In this example, we observed the initiation of a pre-cert case. Moving forward, we will explore the unique capabilities of this application in processing admission cases. Like outpatient authorization, the pre-cert authorization type includes modules such as admin review and clinical review. In case of a denial, a peer-to-peer review may be required if the provider disagrees with the decision. In case of approval, the solution will automatically route the case to the inpatient coordinator's workbasket upon admission and provide a comprehensive case summary for verification, including member and provider information, authorization details, and clinical review comments. Once the inpatient coordinator has verified the member's admission status, the pre-certification case will be automatically closed and a new inpatient case with the same authorization details will be opened. On the date of discharge, the resolved inpatient cases will be routed to the inpatient coordinator automatically. The inpatient coordinator will ensure a smooth discharge by providing patient instructions and a transition facility. In case of facility transition, an option has been provided to enter the facility details. Once the detail of discharge is verified, the admission case is closed. Resolved inpatient cases are automatically routed to the inpatient coordinator on the discharge day to ensure a smooth discharge process, including providing patient instructions and arranging any necessary facility transitions with an option to enter facility details if applicable. Once the discharge details are verified, the admission case is closed. Following completion, a discharge summary will be available. The user also has the facility to check the status of the admission case at any point, where they can view the admission case summary. This concludes the walkthrough of Virtusa's prior authorization solution.